It is my pleasure to introduce Dr. Kristen Kilbourn. Dr. Kilbourn is an associate professor of psychology at the University of Colorado, Denver, where she teaches and trains doctoral students as well as conducts research in the field of health psychology. Dr. Kilbourn earned her PhD in clinical health psychology at the University of Miami, Coral Gables, and her Master of Public Health at the San Diego State University. She also has an active clinical practice where she works with medical patients and their family members. So welcome, Dr. Kilbourn. We're so excited to have you here with us today.
Thank you so much. It's great to be here, and I'm excited to talk about some things in terms of managing and navigating sort of the emotional aspects of chronic illness. So let me share my screen. You can hopefully all see this.
Looks great.
Great. Okay. So just so you know, as you heard, I'm in Colorado, hence the picture here. So today I wanted to talk kind of as an overview. I wanted to talk a little bit at first about some of the emotional toll of managing a chronic illness, which I'm sure many of you are very familiar with. Talk a little bit about the importance of self-care. And I want to touch on at least 3 areas that I think may be helpful. Maybe you've considered, or maybe you haven't thought about much. Social support, coping skills, and positive psychology, some things from there. And then I wanted to touch on just some ideas for how to maintain emotional well-being, as well as one step further in how you can thrive in living with a chronic illness. And then we'll have a lot of time for questions. So I look forward to questions you may have as I'm talking or after I'm finished. So first, when we think of illness, it could be when you're just diagnosed or when you're managing a chronic illness. We know we think of it as a major life event, a major life stressor. And we know what makes illness and health conditions especially stressful are first, just the uncertainty. So often there's a lot of uncertainty about the future. It could be related to, is my illness going to progress? What is my life going to be like? Am I going to be experiencing pain or fatigue or any symptoms? Some illnesses change from day to day. And so it's hard to know how to predict how you're going to feel every day. So this leads to a lot of stress and a lot of distress, which we'll talk more about. There are also a lot of losses that we experience when we're managing a chronic illness. So some of them could be related to our sense of independence and, again, control, not feeling that we have as much control over our environment, over our health, over our bodies. There may be functional losses that we experience, things that either we have to give up or we can't do to the level that we used to do them. Unfortunately, there are often financial consequences that can result in different types of losses in our lives. And then sometimes, illness or health conditions could lead to changes in one's role within their family, of what they're able to do or how, again, this may connect to functionally or financially. How they parent their children, what kind of partner they are, what kind of child they are if they're caring for parents, older parents. So again, a lot of different types of stressors associated with chronic illness. So how do we typically respond to stress? And how do we respond to managing chronic illness? Well, oftentimes it may be anxiety and fear. Again, this is often related to uncertainty about the future, about the course of the illness, about whether treatments are going to be helpful or not, how long will they last, things like that. Depression is very common in people who are dealing with medical illness, and we'll talk a little bit about that, how that's always can be a tricky one to figure out because there's such an overlap in many of the symptoms of a lot of chronic illnesses and depression. Oftentimes people experience anger and frustration. Why me? Why am I having to deal with this? Why do I have this burden of this illness? And this can also result in feelings of isolation. feeling different from other people, feeling that others don't really truly understand what you're going through. And so people may become isolated and less involved socially in social activities. We also know that when we're experiencing a lot of stress, we may engage in what we think of as more maladaptive behaviors. This is our attempt to try to cope with stressful events, but oftentimes, as we know, these are not very helpful. They actually can be detrimental to us. And we saw a lot of this during the pandemic, where we saw an increase in alcohol use. A lot of people gained weight because they were overeating, because they were feeling so stressed and out of control. Behaviors like smoking, use of drugs, marijuana use, things like that may go up again as a maladaptive coping strategy. Some people engage in more risky behaviors when they're feeling stressed. And kind of along those same lines is sometimes what we think of as sort of a lack of adherence, not taking very good care of themselves. So this could be not eating well, not being very active, but it could also be not taking medications, not showing up for your regular doctor's appointments, things like that. And then also when we're feeling stressed, we may tend to feel like we just want to escape or completely avoid the situation. And this can cause a lot of different problems. I'm going to talk a little bit about this a little bit more in a minute. And then there's also denial, where we just sort of don't want to think about it. And this can be, in the short run, not necessarily bad, but in the long run, that can really hinder us from taking good care of ourselves and doing what we need to do for ourselves. So I think, as a health psychologist, I always think it's important whenever I give a talk like this, just to review some of the symptoms of depression and anxiety, because although we're all familiar with the terms, we may not know some of the symptoms, and we may not be identifying it in ourselves or even in our loved ones when it may actually be there. So oftentimes when we think of depression, the first thing we think about is sadness, feeling sad, tearful, crying, that sort of behavior. But we know that many people with depression don't necessarily exhibit a lot of these types of behaviors, but they may show some anger, irritability, especially in men. We tend to see this as one of the more predominant signs of depression as opposed to sadness. Oftentimes people may feel a sense of hopelessness or helplessness. Some of the other symptoms that are common in depression are the somatic symptoms. And these are the symptoms that I mentioned that often overlap a lot with chronic illness. So it can include problems with sleep. With sleep, it could be either problems falling asleep and staying asleep, or sleeping too much. So people can go one way or the other when they're feeling depressed. Change in appetite, also one of those symptoms of depression that can go one way or the other. Most people tend to notice a decrease in appetite and may actually lose weight when they're feeling depressed or they have some type of depression. But there's also some people who actually eat more and may gain weight as a result. Low energy and fatigue is often a common sign of depression. And then there are also a lot of cognitive symptoms that people often don't associate with depression, but are very common. So problems with memory, focus, concentration. Oftentimes these could be a sign that you're experiencing some depression, especially if they go along with some of these other symptoms that we've mentioned, or I've mentioned. Another couple of things that I've always used to differentiate, are some of these symptoms related to the physical illness, or is this really sort of a separate depression? So one of the big ones for me is a decrease in interest. So just feeling like things you usually really enjoy doing, you just don't seem to be very interested in them anymore. So it could be hobbies, that you like to do. It could be connecting with other people, where you're isolating yourself. You just don't want to get together with your friends that usually you enjoy. So that can be a big one. Feelings of worthlessness also. can be very common in depression. And then, of course, at the very extreme end, which we always want to make sure that if you're ever feeling this way, you're talking with someone or getting some kind of help, which is feeling that life is not worth living, or that you'd be better off dead. So always a sign that you should seek some professional help if you're feeling that. Symptoms of anxiety are also very common, and oftentimes people can have depression and anxiety at the same time. Often, the common thing we think about anxiety is worry, sort of excessive worry. Sometimes we call this rumination, where you just can't seem to get that worry out of your head. You may also experience a sense of restlessness or feeling just like you're always on edge. Oftentimes, anxiety can leave us feeling very fatigued. We're using so much energy to manage all that anxiety that it's exhausting. So we may, even though we feel on edge, we also feel exhausted. Like depression, there are cognitive symptoms to anxiety, so also can have an impact on concentration and memory. Irritability is a common symptom of anxiety, as well as sometimes we just have physical muscle tension, or we may notice that our muscles are really sore and tired. It can also lead to sleep disruption. Usually this is worrying, ruminating, just feeling like you can't turn off your brain at night. It's just going, going, going. And then again, at sort of the extreme end, you may experience panic attacks when you have anxiety. And I always tell, sometimes people ask me, how do I know if I've ever had a panic attack? And my response is, most people will know if they've ever had a panic attack. So they're very distinct with the racing heart, problems breathing. You may feel some chest pain, sweating, your body temperature changes. Sometimes people feel detached from their body a little bit, can feel GI symptoms, nausea, fear of losing control. And know that, both for depression and anxiety, we have some really good treatments, evidence-based treatments that are very, very helpful. Of course, medication can be helpful too, but there are also a lot of options in terms of therapy. And I'd be happy to talk about that later if people have questions about that. So one thing over the years of having worked with a lot of people with chronic illness, I started thinking about one of the things that is really significant in the people that I worked with was sort of this, sometimes feeling like they'd lost their sense of self, that they, especially when you're going through a lot of testing, and if you're either like at that initial diagnosis stage, or maybe you're at a stage in your illness where things are changing and getting reevaluated and you feel like everything's focused on your illness, it's really easy to lose your sense of self. And so I kind of came up with this idea that I wanted to share with you, which I think of as a continuum. And I often present to people when I'm working with them individually. So I kind of see this continuum around individuals as they're dealing with medical illness and sort of where you might land. So on one end of the continuum are people who become really overly focused on their illness. Okay, so these are people who become almost preoccupied with their symptoms, how they're feeling, what's going on. They're always reading about it, getting more information. And they get to that point where their illness sort of takes over their life and almost defines who they are. That's almost becomes a big part of their identity. And these people often have, when they're in this place, difficulty adjusting and adapting to changes because they're just sort of become so focused on their illness that they've lost touch with other aspects of their true self. And so they may say something like, oh, I'm sick. I am somehow my illness now. Now, on the other end of the continuum are people who are sort of not paying enough attention. So they're not putting enough focus on their health condition. So they're kind of, if you think of in this sort of avoidant or denial, non-acceptance phase, they don't want to acknowledge that they have this health condition. And so they're often doing things that are not good for them because they're not taking good care of themselves. So they may have poor self-care. They may not be good about adhering to medical advice or medications, or doing the things that they've been told that would be really helpful to them, or things that they've been told that wouldn't be helpful to them. They may be doing those things too. And these people also oftentimes have difficulty adjusting and adapting to their illness, because they're in this kind of place of, I'm not sick. I don't even want to think about it. I don't even want to accept the fact that I have a health condition. So neither of these two ends of the continuum are really a good place where you want to be. You may go into these in and out at different times for a short period, which is fine. You know, sometimes when you get like a new diagnosis, it just takes a while for you to sort of accept it. And you maybe feel like you're in a little bit of denial for a while, and that's fine as long as it's short term. Or if you're going through a lot of testing, you may feel like, oh, I'm so overly focused on my illness right now. And that's okay, again, for the short time. But really where you want to land sort of long term is more in this sort of accurate focus. And the way I describe this is that it's acknowledging that, yes, I have this health condition, this chronic condition, which because of it, I need to take better care of myself than maybe the average person my age who doesn't have this health condition. But it does not define me. I'm still the same person that I always was before this illness. Yes, maybe there are some things I'm not able to do that I did in the past, but that core person that I was before is still there. And that's the really important piece, where your identity remains the same. And people, when they get to this place, it's easier for them to focus on their self-care behaviors. They're much more able to adapt and adjust to changes in their health status as needed, because rather than being defined by their illness or sort of ignoring and not accepting it, they're at this place of accepting that they have this chronic condition, but also recognizing that it doesn't have to define me. So this is the important distinction. Now, I want to talk about self-care, because it's such an important piece. And what do we mean by self-care? So, of course, it's things like maintaining a healthy diet, regular exercise and physical activity, getting adequate sleep and rest, sticking to your medical regimen, whatever your doctors may recommend, just in general, taking good care of yourself. And the key to this is really making this a priority, right? So recognizing that it's really important for my overall self-care. And, you know, I would advocate this for everyone, even people without chronic illness, but especially when you're living with a chronic illness, or you're living with someone with a chronic illness and you may be serving in a caregiver role at times, it's really important that you prioritize this self-care, because it's really going to help you down the road for both your emotional and physical well-being. So I wanted to talk about a few kind of the key things, you know, again, as a health psychologist, that I think are really important for us to be thinking about, especially living with a chronic illness, that things that are good for our self-care and our emotional and physical well-being. So the first one is social support. And we have lots of scientific evidence supporting that role of having people in our lives and how important this is. And I always say it's not quantity, it's quality. So it's not like you have to have a whole bunch of people in your life, friends, family, all of that. It's more the quality of the people that are in your lives. So one thing to ask yourself is, do you know how to ask for support when you need it? Lots of people are really good at giving support, but have a hard time asking for it. So thinking about, why is it so hard for me to ask for support? What are some of the barriers to that? Do you know who to ask for support? This is really critical, because in the social support world, at least, you know, in the research area, we talk about different types of social support. And not everyone is good at providing all types of social support. So we think about, you know, the most common type of social support, or what we often think about, is emotional support. You know, these are people that if you're feeling a little down or anxious or scared, that you can talk to. You can call them, you could go meet up with them, and they just help you to feel better. They let you vent, and they're able to give you a lot of emotional support. Other types of social support are informational support. So, it may be sometimes you're just trying to solve a problem, you want some feedback, you need to make a decision, you need help acquiring information, finding good, accurate information. So this falls under that category. The third category we think about, which is often can be really important for people that are managing chronic illness, is tangible support. These are people that can run out to the grocery store for you, pick up some groceries, or pick up a medication prescription, or could come over when, in a day when you're not feeling great and mow your lawn or help you with chores or little things like that. So the important thing to think about is, first, when you're feeling like you need some type of support, what type is it that you need right now? And who is the best to give you that support? If you think through, like kind of your social support network, you may recognize, like, there's some people that have never been really great. When I really need emotional support, it's not a great match. They're not good at that. But boy, they're really good at tangible support. If I ask them to do something for me, they're right on it and they do it, and it makes them feel good. So kind of recognizing this, and I have provided a handout for you that you could go through when you have time, that might help you sort of identify those people in your social support network that are good at providing these different types of support. And then just thinking about ways that you can increase your social support network. So I know right before my talk, there was you all learned about support groups that are available. I think these are wonderful resources, especially, to be able to be with others who have had similar experiences and be able to connect on that and what's been helpful, that sort of thing. Professional therapy or counseling also can fall under that social support piece. And then I tell people, if you're looking to meet new people and sometimes, and I think actually oftentimes, it's really nice to meet new people that are completely separate from your health issues too. So it's nice to have support group or a network of folks that understand sort of what you're going through medically, but it's also really healthy to have people that like that identity isn't even important to them, that you have these health issues. So I always say, try a new hobby, try a new activity, take an art class, or learn how to play the guitar and join a class. And there's even a lot of virtual things like that you can do right now. So that can be a great way to expand your social support network. And as I said, really, it's the quality, not the quantity, that's most important here. So the next thing I wanted to talk about is just sort of general coping skills. So we know that we talked about maladaptive coping. These are the things that aren't very good for us. But when we think of more adaptive coping, we know that the more sort of coping strategies you have available to you, the better off you're going to be, depending as different kinds of life stressors or stressors associated with your medical condition things come along. The key here is being able to match the stressor with the type of coping that's going to work best for that. So we think of coping sort of as this developmental process, like as we experience over our lifetime more sort of stressful life events, we develop more diverse coping skills. And we know like younger people tend to have a smaller toolbox. As we get older, our toolbox gets a little bit bigger, hopefully. And, the more tools in a toolbox, the more likely you'll be able to manage what comes along. So let me talk a little bit about this idea of matching the situation and the stressor. So it's a really simple idea. And I think if you practice it or think about it, and again, I also have a handout that I provided on this area so that, some of these things are on these slides, you'll have a copy of, but also to be thinking about going through on your own. So one thing that we know is that if we think of stressors, like when we're experiencing some type of stressful event in our life, most stressors have the situation that's going on have a mix of controllable elements to them and uncontrollable elements. So if you think of when you were, for example, maybe first diagnosed with your illness, you can recognize that there were some things that were controllable. So you were able to control the decisions on what doctor you were going to see or where you were going to seek treatment, those kinds of things. But then there are also a lot of uncontrollable kinds of things. May have been, you didn't know a lot about the prognosis, or perhaps that, big one is why do I have this? Why did I get this? So there's a mix usually of controllable and uncontrollable elements in different stressors. And if we can identify those pieces, then we can match the appropriate coping strategy. So for example, when we're dealing with controllable types of stressors, what tends to be the best way to handle these and cope with them are what we call problem-focused coping. So it makes sense. Like, this is something that we can control and change. So it may be we just need to do some problem solving. There may be decision making that needs to be made. We may need to get more information so we can figure out how to solve this problem. And once we start through that process, usually those controllable stressors start to decrease. We're less distressed about them as we're figuring out what we can do, either to get rid of them or minimize them. On the other hand, goal setting is also one. On the other hand, when we're the uncontrollable aspects of a stressful situation, we can't problem solve our way out of them because we just don't know. For example, why do I have this medical condition? We can go and seek as much information as we can, but oftentimes it's not going to be very helpful. And if you think of times when you get, I call it sometimes like the worry wheel, or sort of that rumination cycle where you just keep worrying about the same thing over and over, but you feel like you're never getting anywhere, that's often a sign that we're trying to use problem-focused coping with an uncontrollable stressor. No matter how much we think about that and go through that issue, at least in the moment, there's no solution right now, and we just get stuck there. So that's a good sign, like maybe I need to change my coping strategy here, because this trying to problem solve is not getting me anywhere. So this is where we use what we call emotion-focused coping. So it could be sometimes things just like having someone to talk to can be very helpful. Reframing the situation, thinking about it in a different way. Some people really like things like journaling, being able to write about it, expressive writing. Exercise is a great one. Sometimes just getting outside, getting out in nature, just being able to focus on something else could be helpful, or relaxation exercises. We'll talk a little bit later about like mindfulness practices and things like that can be really good in terms of emotion-focused coping, dealing with uncontrollable stressors. And then a lot of people find, we talked about meditation or spiritual practices can be really helpful in dealing with uncontrollable situations. So this is just, again, kind of the same thing. And you have a copy of this in the handouts, but just again, showing you the active coping strategies. So we talked about kind of what falls under problem-focused, what would fall under emotion-focused coping. And then I just have down below, these are the more what we might think of as passive or maladaptive coping. So, again, it's kind of that denial, not thinking about it, not taking good care of yourself, engaging in behaviors that we know aren't good for us, drinking too much, eating too much, those kinds of things, not taking medication, things like that. So those would be seen as maladaptive. Now, I do also just want to mention that there are other things that can be helpful, evidence-based practices that come from positive psychology. So, for example, gratitude. This was something that I think, especially during the pandemic, or at least the really difficult times of the pandemic, this became something that was talked about a lot. So you can do it in different ways. Sometimes I have people practice gratitude on a daily basis. So maybe through, at the end of the day, thinking about the 3 things that they're grateful for in that day. Those of you who may go, to yoga, oftentimes that may be at the end of a practice, thinking about, sometimes it's integrated into breathing. So 3 gratitude breaths and thinking about things that you're grateful for. We know that in relationships, and most of the research has been in romantic relationships, but it applies to friendships, child relationships with children and family members. We know that gratitude seems to be really important in healthy relationships. So expressing gratitude towards others, and also being the recipient of that. Those things could have a really significant impact on our mood. So, the idea is that oftentimes, and as a cognitive behavioral psychologist, oftentimes we talk about how to, when we're feeling depressed or anxious, how can we refocus our thoughts in areas with less focus on the negative, not necessarily making things overly positive, but how can we get our brain to start to recognize positive things that are all around us also? Because when we're depressed, oftentimes it's like we've got these dark glasses on and we're just missing a lot of the positive things in our lives that are right there in front of us. So gratitude is a really nice method for being able to recognize all the positive things that may be around you and that you may feel grateful for. So as I said, there's journals out there. You could express it verbally, different ways, things that you can do around that. Also, oftentimes, we are just very hard on ourselves. And so self-compassion is an area that's become pretty big in terms of like how to have compassion towards ourselves. I say so often to people I work with, I say, if you can remember one thing from this session, be gentle with yourselves. We are just so hard on ourselves. And oftentimes, when we're going through a lot of really stressful situations and a lot of emotions, we're still so hard on ourselves, holding ourselves up to this very high standard. So self-compassion is about that idea of being gentle with ourselves and showing ourselves some compassion. You can do it in a lot of different ways. There's some great websites out there with experts and kind of guide you through it, and books. But, even just by starting to write down some of that self-critical talk that's going through your head, and then taking 10 to 15 minutes to write a letter expressing compassion and acceptance towards yourself, and reminding yourself that you're doing the best you can, given the circumstances. And this is not always easy. For a lot of people, it's really hard to get connected to that self-compassion for yourself. But if you can, it can be really powerful. And then, of course, and I'm in Colorado, so we have a lot of beautiful places to walk and hike. But, there's a lot now about both mindfulness and nature and all the benefits of nature, these nature baths and things like that. And so sometimes just taking a savoring walk where we're really mindful in that moment of just really being aware of all of our different senses, what we're seeing, what we're hearing, what we're smelling, what we might be tasting, or all the different senses, and just being really tuned into them. And this is really nice because it's just giving us a break. If you think of like the 2 hemispheres of our brain, this is very overly simplified. I'm really overly simplifying it, but the right hemisphere, at least for those of us that are right-handed, tends to be what we think of that more creative side, where the left hemisphere is sort of that analytical part side of our brain, where a lot of that self-talk that's going on, that running commentary that's always going on in our head, sort of resides there. And so when we do things like this, like when we're doing mindfulness meditation, these kinds of activities, we're getting more into our right hemisphere, and it's just giving us a break from all of those kind of constant thoughts and voices that are going through our head. So it can be very beneficial. And then I just want to direct you that there's this really nice site, this Greater Good in Action, that can give you some really other nice ideas of sort of positive psychology things, strategies that you might want to try. So in terms of kind of thinking about maintaining emotional well-being, some things to just keep in mind. First is, and part of the reason that I wanted to quickly go over those symptoms of depression and anxiety is to always be, monitoring that sort of your emotional well-being. I think when you live with a chronic illness, you get pretty good at monitoring your physical well-being, monitoring symptoms, how you're feeling. But oftentimes you forget about the emotional well-being. And it's not necessarily just, oh my gosh, at the extreme level, am I feeling overly depressed or sad or anxious? It's also like, could I bring more joy into my life? How, is there a way that I could move that needle a little bit? So it's not just like that extreme, but what kinds of things could I make changes into to get more out of my life and improve my emotional well-being? So some of these things we've talked about already. Use adaptive coping skills. So we talked about that. So really think about when you're feeling stressed and maybe you've had some sort of stressful situation. It could be related to your health condition, or it could be completely separate. Think about what are the controllable elements versus what are the uncontrollable elements. And based on that, what are the best coping strategies? What are some of the choices I have and what may be the most beneficial in how I choose to cope with these situations and these stressors? Practice positive psychology and some of the great practices that go along with that we just talked about. And then, I'll say as a disclaimer, I'm a big advocate of psychotherapy. So I think it can benefit everyone, but I think especially thinking about when might it be a good time for you to be considering that. So it may be when you start to notice, for example, that your symptoms or emotional well-being has gone down, or like you're anxious all the time, you're not sleeping well. Some of these symptoms that we talked about, they're really starting to interfere with your daily life. So not these things that may kind of come and go and not last long, but you're starting to notice over time that this is really starting to impact me. You may notice that your quality of life has changed because of the symptoms. You're just not getting that same joy out of life, or you're becoming more socially isolated. You're not connecting with friends and family and those kinds of things. You may notice that you're just not experiencing joy in your life anymore. Again, this could be a sign that seeking help and support, professional support might be really important and helpful and beneficial to you. And then, of course, as I talked about earlier, if you're having thoughts that life is not worth living or you'd be better off dead, those are definitely when you really want to think about right away getting support and help. And I also want to I skipped a really important one, which is if friends or family are starting to mention to you or have noticed a shift in your mood or in your behavior, or that things don't quite seem right. Oftentimes, if it's depression or anxiety or some of these types of mood things, they can come on slowly. And so that individual that's experiencing them may not really recognize, how severe they've become, but it may be friends or family that start to notice, that start to show concern. So that's a sign that, okay, maybe I need to think about getting some type of professional help. And then I say, depending on what kind of help you're interested in, there's many options available now. So certainly because of the pandemic, we now have so many more telehealth and virtual therapy options available. There are crisis centers, there are a lot of self-help services, there are different types of support groups. There are all kinds of things that are out there. And so sometimes it takes a while to find what's the best match for you. But I would encourage you, don't give up. If you try something and you say, oh, that wasn't that helpful, I didn't really feel better after that, or I don't feel like I benefited, don't give up, because it may just be that that wasn't a good match for you. And there may be something else that could be helpful for you. So lastly, I want to just talk about this idea of, it's not just like getting by, but this idea of thriving, right? So what do I mean by that? Well, first, it's kind of this, ask yourself these questions and sort of do these sort of self-assessments, I don't know, every couple of months or whatever seems about the right time for you. So what should I do to maintain my health and well-being? What are the things that are important? What are the things that are working well right now? And maybe the things that aren't working so well, and I need to think about incorporating some other kinds of strategies. So kind of always be, checking in on yourself with that. Thinking about, where can I find the support that I need? So we talked about, friends, family, your medical team, how do you connect with them? How do you get that support that you need? How do you ask for that support? I always recommend to people to think about a plan. So think about developing a plan. Again, it's a process and it changes over time. So it's sort of a living document plan, if you will. But thinking about, what do I need? What are my needs in terms of my the physical needs, the things that are important, practical needs, my emotional needs, social and spiritual needs. So spend some time, again, thinking about what your needs are and how you can fulfill these needs. And if there's gaps there that you need to work on. As I've talked about, seek out help when needed. And then, use the opportunity to make positive changes in your life. And so what I say about why I make this comment is, a lot of the area that I've worked in terms of research has been this idea of positive benefit finding. And so it's the idea that when we go through very difficult experiences, and it comes from the sort of trauma literature, where they found that people who went through very difficult traumatic experiences, even though they would never wish them on anyone else, they were able to recognize that as a result of these very difficult and challenging times, it really had some positive benefit. It could be that it made them recognize what's important in their life and what were the things they needed to change. They may have reprioritized those things as a result. In working with people with different kinds of medical conditions, I see them make amazing changes in their lives as a result of being diagnosed with some kind of chronic condition or cancer or something like that. Because suddenly everything changes in terms of what's important in your life and what do you value, and you really start to think about these things that often people don't think much about, although I would say that we should. So think about how, given that you're, maybe dealing with this chronic medical condition, how can that lead to some really positive changes in your life? And it could be adopting healthy behaviors, it could be practicing adaptive coping, and then, as I said, reprioritizing what's really important in your life. So I know that was a quick kind of overview to a lot of different areas, but hopefully at least gets you thinking about some of these things. And I want to thank you for your attention today, and I welcome your questions and thoughts, comments, whatever. Thank you.
Thank you so much, Dr. Kilbourn. What a wonderful presentation, discussion, just perspective shifter. Really appreciate it. We have some questions already in, and as we've already started moving into our Q&A session, I'm going to remind everyone to please go ahead and type your questions into the Q&A module if you have not yet, at the bottom of the screen, and I'm going to read them out loud for our presenter to answer, and we'll get to as many as we can. Okay, starting us off, I love all of the great suggestions you have provided for support, but I have a hard time accepting that there are now things that I cannot do that I used to enjoy doing. I know I should focus on what I can do that I still enjoy, but it's hard not to resent being unable to do those other things. And I'm grieving the losses of those things. What can I do?
Yeah, so great question. So certainly there, with that, we talked about the losses, and with that is grief around those things that you may not be able to do that you once did. But I also, when we talked about that, that not allowing your illness or your disease to define who you are. And oftentimes that's where it tends to creep in, when suddenly, like, oh, I was a big mountain biker and I love mountain biking, and now suddenly I can't do that anymore. So somehow my illness is defining me now because I can't do these things that used to be important. So what I often say is certainly there's a grief process around that, but then also somehow staying connected to those things. So for example, you may not be able to go mountain biking, but what were some of the things that you loved about mountain biking? It may be being out in nature. It may be, being that wind and that movement, so thinking about what are other things that I can still do that somehow connect me to some of the things that I loved about those activities that in the past I was really involved in, that I'm not able to do, or not able to do at the same capacity anymore. So not to just completely shelve them and put them away and say, I don't want to think about it anymore because I can't do it. Think about, are there other pieces to that you can still enjoy? A lot of people, like, for example, someone that I know, who was a big tennis player, loved tennis. That was a huge part of their life. Rather than completely just giving it up, they still enjoy tennis, watching tennis, the culture of tennis, engaging still with their friends who play tennis. So thinking about how you can still somehow stay connected if these things are important to you, if that makes sense. But it's certainly a process, and there is going to be a process of grief with that too, that comes along with it. The other thing I will add that I've seen that people have done really successfully is finding new hobbies and activities that maybe they never considered that they're able to do, or have fewer limitations in, and then just becoming really absorbed in that, like taking up a new instrument, or, it could be something crafty or artsy, or kind of depending on that. So that can also be helpful, because then rather than feeling like you're just losing something, you're adding something new that maybe you've never done before.
Absolutely. Thank you very much. Next question, it's kind of a comment and a question as well. This person shares, I was an avid skier. I decided that it was too much of a risk to continue. And just some background, it's, mostly because with spondyloarthritis, the spine can be quite fragile. So a fall really might be dangerous for some people. They're not a skier. Partner, I'm assuming, encouraged, cajoled, and indicated that they think I should continue to ski. I am enjoying it, but I don't know if I will blame my partner if something catastrophic happens. So what insight or kind of advice would you have in this situation?
Yeah, that's a tough one. That's a lot of great insight. Whoever asked that question of recognizing that could lead to some resentment and conflict in the relationship. Those are all going to be sort of case by case. I think when making those types of decisions, it's sort of doing that analysis of risk benefit, of the risk of if something did happen, versus the benefit of what I'm getting out of this. I think, kind of similar to the last question, if they're, especially with a partner involved, or a friend or family member, whomever this might be, is there something else that you can enjoy together that could be enjoyable with less of the physical risk to your spine or getting injured? Or is there a way to, this is probably a bit of a lame example, but I tore my ACL long time ago. And so when I did that and I never had it repaired, my skiing changed a lot. Like I became not doing those black mogul runs anymore because it just wasn't worth it. So is there a way where there's some sort of place where it feels a little bit more comfortable, where it may not be at the level that you were used to, but there's some sort of intermediate there? But again, it's that risk benefit. But I think also, the more we can have open communication with our loved ones too, about recognizing that, that it may be important skiing, but there's also the risks, and kind of talking that through with them, and what would that be like if something were to happen, because likely they would also feel have a lot of distress around that too. So kind of talking that through with them. So hopefully that's helpful. But and then it may be thinking, again, I would emphasize, like, are there other activities that are less risky, maybe new things that you could think about doing together, trying together? That could be fun.
Yeah, thank you very much. Kind of along the same lines, if we can discuss communication with loved ones, relationships, and how chronic illness can sometimes impact that. And a specific question that came in around this is, when friends and family or colleagues say, "But you don't look sick, you look fine," how can I keep a positive attitude with the lack of support and yet try to educate them?
Yeah, that's such a common question that I hear, and a lot of people struggle with this. So I think it's definitely, there's a place for educating others, because I always say that the average person who hasn't really experienced, like, either personally a lot of health issues or illness, or who hasn't experienced that with others close to them, there's sort of like these two models, I think, that most people have in their head. Like, there's a sort of acute illness where you get sick, and either you get better and you get back to normal and you're fine, or you get sick and you just go down, down, down. And so this idea of these types of chronic illnesses, where oftentimes there's a lot of unpredictability. You may have days you feel good, you may have days you don't feel so good, but as people say, they wouldn't necessarily know by looking at you or talking with you. So educating them to help them understand that, I may look okay, but because of my health condition, I have fatigue, I may have brain fog, or I may have pain that I'm having to manage that takes a lot of energy. And I just may not feel well, or may not want to engage in whatever it is, some of the behaviors, the expectations they may have for you. I think that those conversations, also recognizing that they don't have to be the same with everyone. So there's also what goes along with this that I hear a lot, work with people on, is sort of disclosure. How much do I want to disclose to other people my medical condition or details about it? So know that can vary from person to person. People at work, you might not feel comfortable disclosing a lot, where people that you feel close to, close friends or family, it may be more comfortable. So you don't have to disclose the same amount to every person. But I think just letting people know that, I may look okay, but that doesn't necessarily mean that I'm feeling okay. And, fatigue, especially fatigue and pain, are two things that people often don't realize that, and if they haven't experienced them, they don't know what that feels like. So sometimes it's just doing a little bit of education around that can be really helpful. And recognizing that you may have to do it multiple times as reminders.
Yes, thank you. How do you select a counselor, and how do you know that they are helping, that it's a good fit?
Yeah, that's a great question. The selecting a counselor, so I always say, when it comes to finding a therapist, it's all about the match. And so you want someone who you feel comfortable with. I'm a little biased because I'm a health psychologist. So I feel finding someone, and it doesn't have to be someone at the doctorate level. There are great people, master's level, but someone, I think, that has some, at least, background in understanding how living with a chronic illness impacts an individual in terms of their quality of life, and different areas of their life can be very helpful. So, one thing, if you're going to use insurance, is you can get information from your insurance company and just get a list of people. And I think as you're going through, you may want to ask them if they are have work with people with chronic illnesses, if they have any experience with that. I do cognitive behavioral therapy, and as well as like a mix of existential and acceptance and commitment therapy. And these are all evidence-based therapies that we know work really well, not only for depression and anxiety, but in the health psych area. They've shown a lot of good evidence for managing pain, managing fatigue, managing different medical symptoms. So, finding people like, for example, cognitive behavioral therapy, I think could be helpful for a lot of people that are dealing with medical illness. And then if you can set up, just like a 10 or 15-minute phone call, or some therapists will even do it virtually, where you can at least have a chance to talk with them, ask them some questions. What do you envision the therapy sessions are like? Do you have, the average person you work with, how many sessions do you work with them? What does that look like? What would it be? So like when I work with people doing cognitive behavioral therapy, it's very much like a team. We're working together. So you'll come in, work with me, you figure out, let's try this. Let's try this strategy. Let's see if this helps. The next week you'll come in and was this helpful? Not so much. Let's fine tune it. Let's think about other things. So it's very much working as a team. It's not sitting on the couch and, sort of that psychodynamic where you're just going to be sitting there sort of passive. So finding out what's that therapist sort of their model, what type of therapy they do, what their sort of expectations for you as the patient or client are, those kinds of things I think can be really helpful. And then just kind of going with like how you feel after talking with them. Did it feel like that was a good click? The communication was good. This seems like someone who might really understand me, or maybe not. And so I would always recommend talk with, if you can, at least like 3 people and sort of see. And if those 3 don't seem good, then try more. But definitely that feeling feeling comfortable with that person and being able to develop a connection where you feel safe and trust them those are the key components to a good therapy counseling experience. So you want to make sure that you have that level of comfort when you're first starting to work with someone.
Thank you. And a kind of a follow-up, for anyone who may not be quite so familiar with therapy, when you start therapy with a counselor, do you, is there an end date, or is it an ongoing thing usually? What should you expect?
No, that's a great question. So it kind of depends on the person and the issues and things like that. I feel like sometimes when people come in, like something has just happened. They've had some sort of major life event or stressor that sort of made them recognize like now's the time where I really could use some help. Or maybe they've really noticed a big change in their mood. Or as I said, people are starting to give them feedback like, wow, you seem more anxious or depressed lately. So depending on the issue, oftentimes it may be like really working first to help someone get through that acute issue. And then it may be other things that come up, changes that they want to make in their life or things that they want to work on. So for some people, sometimes it can be, I have a lot of people that I see that kind of come in, they have some sort of acute events that are going on. We get through that. It might be 8 sessions, it might be 10 sessions, it might be 15 sessions. And then they may be feeling like they're doing pretty well. And then they'll kind of go off and take a break, or we'll have sessions less regularly. And then I have, because I've been doing this for so long, I have, people who then may have another life event that comes along, and then they'll come back in and we'll maybe have a few sessions and kind of get them back on track. And I think that especially in health psychology and working with people with chronic illness, that happens a lot because, you have things like come up and then you're doing pretty well. And then something else comes up and it's like, oh gosh, it'd be good to go back and get some reminders of things that were helpful for me, or kind of get back on track, or help me get through this like stressful event that could be completely unrelated to health issues, but just sort of life events that come up.
Thank you. That's helpful. Can an increase in OCD be connected to depression and anxiety?
Yeah, so definitely, it depends if we're talking about OCD as an actual disorder. Sometimes we talk about OCD, so obsessive compulsive behaviors, that wouldn't necessarily fall under the diagnosis of the disorder, but people may find that they have certain behaviors, sort of like compulsive behaviors, or this need to have everything in order, or a need to be checking things all the time, or worried a lot about things not being just right, overly perfectionistic. Definitely something that we see when people are feeling more depressed or more anxious. Additionally, someone who actually has obsessive compulsive disorder, if they're feeling more stress, we usually see an uptick in their symptoms. So that's very, very common. So like, for example, during the pandemic, people that had OCD that may have been really well managed up to that time, we saw a big increase in symptoms and people struggling with their symptoms, even if they'd been managing them well for years. So, oftentimes what can happen is if we're feeling sort of out of control in our life, and maybe starting to feel a little depressed or anxious, we sort of fall back onto these sort of compulsive or perfectionistic types of behavior, because they, in the short run, sort of give us a sense of like control. They kind of are like, oh, feels like I have a little more control. I've got everything like in order, but they're not very good in the long run. They're not really giving us any long-term relief, and they're taking away a lot of time and energy just engaging in these behaviors. So I guess my long answer to the short question is yes, certainly that's something that we see quite often with people who have high levels of stress or distress, depression, and anxiety.
Yeah, thank you so much. If we could discuss managing and treating anxiety, and how do you know the difference between, a normal level of anxiety as a response to either chronic illness or something else, and really when you need to seek help?
Yeah, that's a great question, because a lot of the work, like when I'm first starting to work with someone, let's say, who's been newly diagnosed with a medical condition, is just helping to normalize, recognizing that, when you're dealing with something new, this is a huge major life stressor. It's normal that you're going to feel anxious. I would be worried if you weren't. I'd be more worried if you felt nothing. But then at what point does it become a problem? So usually, when you're going through either just newly diagnosed, or let's say you get some new information or news, if you've had something's happen, like your illness has worsened or progressed or something like that, those are what we think of as like adjustment. You're going through this sort of adjustment period of sort of readjusting. Your brain is readjusting to like, okay, so now I got to deal with this. And this is really stressful because I don't know, I've never had to deal with this before. And I feel very out of control and there's a lot of uncertainty. But usually over time, it could be a few days, it could be a few weeks. We kind of see, like, as you start adjusting and recognizing, like, okay, gaining confidence that I can cope with this, I can manage this, I have, some people that can help support me, I have coping skills. You'll see like a decrease, not necessarily go away, but decrease. So if that's not happening over time, then that's usually a sign like, okay, now it seems like I might need some help with this, because I'm not noticing that I'm adjusting very well to this, or it doesn't seem to be getting any better, or maybe it's getting worse. So that's usually, and then the other thing is, as I said in one of my slides, is when it's really starting to interfere with your day-to-day life. If you're noticing that you're just every day or every couple days, just like expending so much energy to manage, whether it's your anxiety or panic symptoms or your worry, it's just like consuming you. You feel like your quality of life has really gone down, like your life has changed as a result of this. That would be another sign that it would be a good time to seek some professional help.
Thank you so much. Actually have a comment from an attendee to another attendee I wanted to read. To the former skier, they say, consider cross-country skiing. It doesn't give you the rush that downhill does, but it gets you out in the snow, peaceful, less crowded, less expensive, and a good workout. Good luck. And then people are saying thank you to you, wonderful presentation. Someone is sharing that prayer is what helps them cope.
Mm-hmm.
And then back to our questions. Can we discuss medications? Are there medications that can cause or aggravate depression or other mental health issues?
Yeah, that's a great question. I was going to add though a little plug-in. Snowshoeing is really a good one too. So let's try that. That's a great
Snowshoeing.
workout also. Um, oh, so medication, so certainly one of the most common, if we think about medications that is often prescribed for people that are dealing with a lot of chronic illnesses, especially ones that are related to inflammation and pain, are the steroids, prednisone being one of the big ones. And we know that prednisone is very much can contribute to mood problems. So not only sleep, so those of you who've taken prednisone before probably experienced the issues with sleep, but we know that it can be cause irritability, a lot of issues around anger, depression, anxiety, and at the most severe, and I will say, I've only seen one person in my whole 25-year career that ever had this, but even psychotic symptoms in the extreme. Again, very, very rare, but just to give you an idea. So prednisone is definitely one of those medications that can have an impact on mood. And so being aware of that, but it's very, it kind of depends on individuals in terms of other medications. And I'm not as familiar with all the medications that all of you that are here today may be on, but I think it's worth considering and talking about, with your treating physician and the possibility that they could be contributing certainly to issues around not just depression, but anxiety. Some medications can really have an impact on irritability and just that sort of fight or flight kind of feelings that we have. So they could exacerbate worry and fear and things like that. So, yeah. So, and then, what is the answer to that? That's always a little more difficult. So sometimes if it is that the medication may be having that effect, is it something that you could change to something else? Is it possible to decrease the dose? Is it possible, that maybe during that time when you're taking that medication, they also want to put you on something to help manage your mood, or an antidepressant or something for anxiety. A lot of people aren't crazy about those medications, but I always say, don't think about it for a lifetime. Like, I don't want to add one more medication to my list. So I always tell people, don't think that necessarily you're going to have to be on this antidepressant for a lifetime, but if it can help improve your mood and improve your quality of life, at least for now, maybe it's worth a try. Down the road, you can decide if you want to continue it or if you still need it. So that's how I try to kind of approach some of those questions around medications and what can be helpful and sort of the pros and cons.
Yeah, thank you. Very helpful. Can we discuss feelings of overwhelm, burnout, and how these can manifest in our emotions and behaviors? And then what are some helpful actions and tools to help move us out of this space?
Yeah. So, oftentimes, so as a cognitive behavioral psychologist, or I use cognitive behavioral therapy, oftentimes what happens, so the idea in CBT, what we call it, is that we have this constant sort of self-talk that's going on. I kind of talked about that, tends to reside sort of in that left hemisphere. And so there's this running commentary that oftentimes we're not even aware of, that's always going in our head, kind of telling us what we should be doing, or kind of making comments about us personally. Sometimes it's self-critical, so it's not always negative, but oftentimes this self-talk can become distorted, but we don't really recognize it as distorted. We just accept it for what it is. So in cognitive behavioral therapy, we focus on sort of these thoughts, these automatic thoughts that are going through our head, and recognizing when they become distorted, because when they become distorted, it can lead to a lot of distress. So be it depression or anxiety or just increased stress. So one of the ways oftentimes this will manifest, sort of connecting to this idea of burnout, is that we call this sort of the shoulds, or I call it also black and white thinking. We set very high expectations for ourselves, and sometimes for others too, but we'll focus on like ourselves right now. these really high expectations for ourselves. And if we don't meet those expectations, it's all bad. That's where the black and white comes in. Sometimes I call this perfectionistic behavior also. So we have this sort of idea of what we should be doing, or what we shouldn't be doing. And if we don't meet that, it's all bad. And so, the key things to recognize when you're having these types of distorted thoughts are, for example, the shoulds. So, sometimes people like to say, oh, I'm shoulding myself again, because when we're saying something like, oh, I should be doing this, oh, I should be able to do this, or I should be able to keep my house clean, or I should be able to manage my kids and my work and everything else. What we're doing is we're putting all this pressure on ourselves. We're creating these expectations that oftentimes are unrealistic, especially when we're managing a chronic illness. We're often like setting expectations that may have been the same expectations that we had before we had this chronic illness, and we were having to deal with, pain or fatigue or some of these other things. And when we don't meet the expectations, it causes a lot of disappointment. So we'll be really hard on ourselves. It may lead us to feel really anxious. It could lead to angry at ourselves. We may become depressed, and it can lead to burnout, where you just feel like, I just can't do it anymore. I'm just not good enough. I never can reach that expectation. So what in cognitive behavioral therapy, I work with people on first recognizing those thoughts when they're experiencing them, and then really challenging them, not just accepting them as they are, really challenging them. So what evidence do I have that I should be doing these things? What evidence do I have that I don't need to be doing these things? How can I allow, rather than being so black and white, how can I allow myself some gray? So if I set this expectation, but I get to here, that's okay. I didn't have to get to here. So rather than being just black and white, allowing for a lot of gray, which I always think, especially when you're dealing with medical issues, is so important, because you don't know always how you're going to feel from day to day. And it may be unrealistic, some of the expectations that you set out for yourself. So that's how we approach it from the cognitive behavioral side, is really getting people to recognize when they're having those distorted thoughts. And then, going back to what I talked about before also, is that idea of self-compassion and just giving yourself permission to just be gentle, that you don't have to do all those things that you think you need to do, and just being gentle and kind to yourself. So hopefully those are some helpful suggestions.
Very helpful. We're just about out of time. I'm going to follow up with one quick question. So we discussed a little bit about being gentle and kind to yourself. Can we give some examples or some additional examples of what that looks like, and also what the opposite of that looks like? So
yeah,
we're not doing that.
Sure. So the opposite, is that being aware, like that self-critical voice. That's you should be doing this, you shouldn't be doing that. That's really constantly kind of telling you all the things that you're doing wrong, or that you should be doing, that you're not doing well enough, you're not good enough, that kind of thing. Where self-compassion is this idea of really not, when part of it is recognizing all of the good qualities, the good parts about you, all the things that you're doing well, all the things that to be grateful for that you're doing, to recognize those aspects of yourself of the positive pieces to you, rather than always focusing on the negative, of just showing that sort of self-respect for yourself, and that, like, again, being gentle with yourself. All of those kinds of things are, I think, a good start. If you Google self-compassion, I think it's Kristen Neff. There's a great website on self-compassion and things to get you started. That could be really helpful. Exercises and things like that. So I would say maybe check those out. The other thing is just remembering that you are doing the best you can do, being gentle with that.
Thank you so much, Dr. Kilbourn. We're now concluding this very helpful Q&A session. I want to thank you for so generously sharing your time and expertise with us. It's just been an immense pleasure having you with us and having you share your wisdom and your compassion and your expertise with us. Thank you very much.